All right, let's get into it. We're going to talk about something you probably see every day, a simple houseplant. But what if I told you it has this surprising power to actually help us heal? And yeah, there's real science to back it up. So let's just jump right in with a kind of wild question. Could a potted plant, the one sitting in the corner of a hospital room, could it actually work like a painkiller? I know, it sounds a little out there, but trust me, the science here is pretty surprising. Okay, so take a look at these two rooms. They look pretty much identical, right? But there's just one key difference. The room on the right has plants. So the big question is, does that small green addition actually make any real difference for the person trying to recover in that bed? Well, to answer that, we've got to look at the data. And there's this one fascinating clinical trial that gives us a pretty clear answer. Let's call this a surprising prescription. So, how they test this? Well, back in 2009, a study took 90 patients who were all recovering from the same thing, an appendectomy, and put them in rooms just like we saw. Half got rooms with plants, half got rooms without. Super simple, but a really elegant way to test the idea. And this is the big takeaway. Check out this chart. It shows who needed painkillers. The control group, the ones with no plants, are right there. Now look at the plant group. See that drop? By just the third day, the patients with plants needed way fewer analgesics. And we're not talking about a small change. That's a real, measurable clinical difference. And get this, it wasn't just about the painkillers. The benefits just kept stacking up. Patients who had plants in their rooms also had lower blood pressure, lower heart rates, and when asked, they said they felt less pain and less anxiety. Plus, they just flat out liked their rooms more. So yeah, these plants were doing a whole lot more than just looking pretty. Okay, so you might be thinking, that's just one study, right? But it's not some random fluke. This is actually part of a whole field of study. Let's dig into the actual science of healing that explains all this. Yeah, there's an actual name for it, horticultural therapy. And it's a legitimate, recognized practice. We're talking about trained professionals using plants and gardening to hit very specific clinical goals for their patients. So this isn't just, here's a flower to cheer you up. It's a real targeted therapeutic tool. And this idea, it's not new at all. It's got deep roots, going all the way back to the 1800s. But the real game changer came in 1984. A researcher named Ulrich did this landmark study, and what he found was incredible. Patients who could see trees from their hospital window recovered from surgery faster than patients who just saw a brick wall. That one study really lit the fuse for all the modern research we see today. So at this point, it seems like a no-brainer, right? Just put plants in every single hospital room. Case closed. Well, not so fast. There is a twist. A pretty serious one, actually. A hidden danger we absolutely have to talk about. Because you have to look at this from another angle. While some experts are seeing all these healing benefits, infection control specialists, they see something else entirely. They see a threat. And they are not messing around. Their guidance is incredibly direct. This quote from the International Society for Infectious Diseases says it all. The water in flower vases can be crawling with microorganisms. They say point blank that flowers and potted plants should be avoided for the most vulnerable patients. We're talking about people in the ICU or anyone with a weak immune system. And this isn't just some vague, be careful warning. They've identified these specific culprits, the actual bacteria lurking in that plant water. We're talking things like Acinetobacter and Pseudomonas. Now, you don't need to know exactly what they are, just that they are serious pathogens that can cause really nasty infections, especially when you're already sick in a hospital. So now you see the problem, right? This creates a massive dilemma for hospitals. How on earth do you balance these two things that are both true? This is the hospital's big balancing act. I mean, it's a real two-sided coin. On one side, you have the undeniable benefit. Plants make people feel better, less stressed, and they need less pain medication. But on the flip side, you've got the risk. Those same plants can harbor germs that are really dangerous for the sickest patients. It's the classic benefit versus risk showdown. Which, of course, leads to the million-dollar question. Is there a way to get all the good stuff without the bad stuff? Can you get the psychological boost without the germs? Can we have our cake and eat it too? Well, it turns out someone decided to test a brilliantly simple idea. Researchers ran an experiment in a hospital waiting room, and they asked a great question. What if the nature isn't actually real? The experiment was super straightforward. They had 3 different versions of a waiting room. One group of patients waited with real plants, another group waited in a room that just had big posters of plants on the walls, and the third group, the control, got a plain room with no nature stuff at all. And the result? This is so cool. Both the real plants and the posters of plants worked. They both significantly reduced stress for the patients. It turns out our brain gets a similar calming effect from just looking at a picture of nature. No germs required. So why does a picture work almost as well as the real thing? Well, a big part of it comes down to what researchers call perceived attractiveness. Basically, if a room looks nice and pleasant, we feel less stress just being in it. It's that simple. Our brains are kind of wired to see a nice green scene and think, okay, this is a safe, calm place. And that really brings us to the final big idea here. If something as ridiculously simple as a poster on a wall can actually measurably reduce stress and help people heal, it just makes you wonder, right? What other incredibly powerful secrets to healing are just sitting there hiding in plain sight?